Hello, everybody. Thank you for having me come in and speak today. So I was asked to talk about combating COVID-19 in rural communities. So I will start there. Next slide. So this first slide that I'm covering is the current data within Wisconsin. I apologize, this is December 8th. It is updated every day, but because I had to have this in yesterday, that was the most recent data available. And clearly we see our counts go up on a daily basis. Active counts in the state of Wisconsin right now are about 57,813. And we have seen in the recent months an increase in our hospitalization and death rates. Next slide. And then could you click on the link on the bottom, please? So this next area that I'm going to talk about is health impact by race and ethnicity. And if we scroll down a little, keep going. All right, so you're going to see this chart right here. And what this chart shows is our case rates for Wisconsin. This particular first slide shows that Hispanics on a case per 100,000 basis have a higher rate than others in the state. So they are 1.8 times higher than the average rate for cases here in Wisconsin. If you click down one dot, it shows the hospitalization rate. So over on the left-hand side. Yep. And here it shows that Hispanics are also hospitalized at a higher rate than others in the state of Wisconsin, or whites in the state of Wisconsin. So we are just about like 1.6, 1.7% higher here for Hispanics. So the reason I'm touching on this is because when we talk about our rural communities and farming, at least here in Kewaunee County, we have a high percentage of Hispanics that work within our farm community. And I often hear, oh, well, the farmers aren't affected by this, or, you know, we don't see cases on our farms. Well, we do see cases on the farms, and we do see that our staff on the farms are affected. And I just wanted to point out that this shows that our Hispanics do actually have a higher rate than whites in the state of Wisconsin. Next slide. So basic recommendations for COVID-19, I think you probably are all well aware of this, would be to, number one, stay home when sick. It's the single best thing that we can do to prevent COVID from spreading in our community. Next, we ask people to social distance out 6 feet, to wash their hands frequently, and to use hand sanitizer if hand washing is not an option. Masking is another thing that we recommend for people, and I do realize that in our farming communities, sometimes that's hard with their job to do the social distancing and the masking. So we'll touch on that in just a minute. One other thing that you can do to avoid getting sick is to avoid touching your face. We do recommend that anyone who is symptomatic or has been in close contact with someone who has tested positive get tested as soon as possible. And finally, from the local health department side, we do follow up with isolation and quarantine guidelines for each person that is tested positive and who is listed as a close contact of a person who is positive. Next slide. So what makes these basic recommendations difficult in a farm setting? And I just wanted to touch on this because I think that here, at least, we see our farming community as a unique work setting, and it's sometimes overlooked, I feel, in state guidance. So in September, they changed our guidance where essential workers had been given a little bit more leeway as far as going back to work or continuing to work if they were asymptomatic. That changed in September, and we were told that they could no longer do that. But I think that we really have to think about that in the agricultural setting, because oftentimes our farmers cannot allow their staff off if they are a close contact and are asymptomatic, because it might mean that they may not have the staff to continue operations on their farms. So we realize that. So here, at least in Kewaunee County, we've looked at that essential worker clause, And we ask, you know, can we assure that the people that we are giving a quarantine to, can they work in an area by themselves? Because that makes a big difference if they're asymptomatic but can distance out from others. Are they symptomatic? That's the big question. Or are they experiencing symptoms? Then they shouldn't be in the farm setting. But if they're asymptomatic, can we continue to have them work, and can we have them continue while wearing that proper PPE? We also have looked at, you know, farmers having maybe some limited hand washing facilities. So can temporary hand washing stations be added? Can hand sanitizing stations be added? And can each employee be given a designated bottle of hand sanitizer that they carry with them, so that irregardless of the setting that they're in, they have that available to them as a tool? I understand that masking is difficult. Wisconsin as a whole has struggled with having people following our masking update or mandate, but you know, can disposable masks be made available on some of our farm settings, so that at the end of a shift they're getting thrown away and these people aren't forced to wear something that's soiled and dirty? If they're using the cloth masks, which a lot of our farms here are they laundered on a regular basis? Are they laundered daily? Is there a supply there so that they can wear clean masks throughout each shift? Once again, free testing is available throughout the state, and we recommend that anyone who has been in close contact with a positive case or who is symptomatic, that they get these tests done. So, you know, is there, with our, sometimes with our population, there's a language barrier that can make some of these kind of things tough. So, you know, have we designated someone on the farm that can help them with pre-registration for testing? Is someone available to transport employees to a testing facility if they don't have that proper transportation, which can be an issue? So there's a lot of issues that we look at with getting people the services that they need. And then following that isolation and quarantine guideline, you know, has someone from your county health department reached out to your staff, and have they gotten the proper guidance that they need, or are they kind of being left to fly solo and take a guess or a gander as to what that guidance really means? So if you could go to the next slide. So those are some of the questions that were brought up by our staff here to look at, so that we were a little bit better prepared. And here, at least in Kewaunee County, some of the unique issues that we face, and I feel that other rural communities face, could be a lack of public transportation, a lack of a hospital. Here we have no hospital. So how do people get to a hospital if they need help, or how do they get to the emergency room? A lack of testing sites. I know that within our county, we experienced a lot of or very little testing as far as our testing sites at the beginning of this whole pandemic. And we have increased now, but we increased because we really encouraged our healthcare systems to reach out to their rural communities and make sure that the people here are being covered. Is there a lack of resources for people who are limited English speaking? So, you know, what kind of translation services are available, and how can we help them work through that translation process? Is there a lack of emergency food or shelter services? Are there larger groups of farming employees living together in group housing? I know that we see that pretty frequently on some of our large dairy farms here. And then is there a lack of isolation or quarantine facilities? So these are all issues that have been brought up in our planning phases that we have tried to work through. Next slide. So here in Kewaunee County, we've, like I said, done some brainstorming and done some outreach to some of our farms to see what we could do to help face some of those challenges that they face every day. And what we have found is that by communicating with them on a regular basis, they get the needed guidance that they need to function. So we have a daily newsletter that goes out 5 days a week. It is shared with our UW Extension farm agent, but it is also shared with our chambers, All of our municipalities, our clinics, our schools, our long-term care facilities, it goes out to it's well over 400 entities that are getting that daily update with all the latest guidance coming out from the state. And we find that that helps because then they have the resources that they need to at least look up the information if they have questions. We've also established a contact at each of our large farms to help ease communication when a positive case is identified. So we have an individual that is either in an HR kind of position or in management there that we reach out to let them know, yes, you have a positive case, and we discuss the guidelines moving forward as to what that positive case should follow. We also let them know if there are contacts, close contacts within the farm that maybe should be watched or should not be working actively if they are symptomatic. In addition to that, we provide letters to each of our farms on each positive case or close contact, and we let them know when the start of their quarantine or isolation period is, and then when their release date is, so that they know specifically, yes, this person can be back at work. And we've also assured them that that communication will only come from the county, so that they know that if an employee is saying, no, I'm good, I can be here, they really need to have it in writing. So we get a specific email or a fax number so that it's coming directly from us, and they are assured that, yes, that employee is safe to return. Once again, we assured testing facilities within our county are available. So we have one in each basic corner of the county. And we want to make sure that all of our residents have a testing facility within 30 miles of where they live. We've encouraged farms to establish assistance with transportation of people who may be symptomatic or who need to get medical help. So what we do is we ask them, have you had a positive case in the past that's cleared? And if that positive case falls within this 90-day grace period where they don't have to be retested, maybe that's the person that you could assign transportation to, so that if you have an employee that is questioning whether they might be COVID positive or asking to be transported, say, to a hospital, ER, whatever that might be, you're not putting other people in danger that could then become contacts or positive cases. It also helps with their staffing, because if you use people who have been positive and are, in that period where they can't spread to anyone and can't really catch it again, it's putting less of your own employees at risk. We have had farms in our community that have done assistance with food package programs. So they have like a mini food pantry, for lack of a better word, set up there that they can send a box of like dried goods home for an employee who tests positive, who might have limited transportation and isn't going to be able to get to a grocery store or something like that. So, or doesn't have other family that can do that for them. So we have set up those assistance programs on some of our farms. In addition, we made sure that we have a diaper bank or diaper drive available here at the county. So if families have younger children and have someone in their household that tested positive, they are now in quarantine or isolation, we can make sure that we can get them the diapers that might be needed for their infants, and make sure that they're not going out in the community at a time when they shouldn't. And the same with infant formula. So we've done purchasing of emergency formula for families that may need help with that as well during isolation and quarantine. And finally, we do a lot of communication with our schools to ensure that they know what students can be in the buildings at any given time. So they know precisely what families have tested positive or have been a close contact, and then we give them a date of return so that those students stay out of the school facilities that are open until their return date is listed. Next slide, please. And then for those of you that aren't aware, the CDC came out with new guidance for quarantine within about the last week or so. It went live in Wisconsin on Monday. And with this new guidance, we can quarantine people who are close contacts and have remained asymptomatic for a shorter period of time. So typically when you come in contact with someone who's a positive case, you're told to remain in quarantine for 14 days. With this new guidance, they could quarantine for 7 days, get a test on their 6th or 7th day, and if that test comes back negative, be released to go back to work, but remain on a program where they self-monitor for the remainder of the 14 days. They also have an option where they can do a 10-day quarantine, and if they stay in quarantine for 10 days, then they can return to work without a test, but self-monitoring those remainder of the four additional days. Or they can choose to do the original quarantine, which is the 14 days. So we have more options available, and these options will allow people to get back to work a little bit sooner, especially in hardship cases, which I think are often seen on our farms where there is such a limited amount of staff or funding to help pay for some of the employees that work there.